anyone to learn about what we do at MedTech Innovator, to have a chance to participate. I'm starting our live stream right now on YouTube exactly for that purpose. So when we're live here on MedTech Innovator's website at medtechinnovator.org/live, anyone who wants, anywhere in the world, can have access to the same resources, the same information as the companies that are part of our annual cohort. And just for a little bit of context, MedTech Innovator this year in 2020, this is our 8th year of running the MedTech Innovator program. We had over 1,000 companies apply to be part of our US program. That was an amazing feat for us. Last year it was 800, so to go over 1,000 this year is pretty incredible, which means it's a very competitive program. That's the point. And the companies that are part of our program really do represent some of the most exciting, compelling companies in the entire world as it pertains to the MedTech industry. And I say MedTech, I mean medical devices, digital health, and diagnostics. So again, if you're just joining, I'm Paul Grand. I'm the CEO of MedTech Innovator. My background was as an entrepreneur, having started 8 companies. I then went on to become a venture capitalist for 12 years. And while I was in that role, I started MedTech Innovator. And I started MedTech Innovator with a very specific purpose. It was to find innovators, to find the innovators that really had a chance of being successful and making sure they got the spotlight, making sure we put them on the center stage. So that's some of the background. Today's webinar is the first in our series. It is focused on perfecting your video. Now, I'm going to be pretty specific in the discussion today, talking about a 1-minute video. You may choose ultimately to make a 2-minute video or a 3-minute video, whatever's best for you. But for our purposes in the MedTech Innovator program, we ask people to make a 1-minute video. And the reason for that is, there's many reasons. One of the reasons is that we think telling a story in 1 minute is a great discipline. And you'd be incredibly surprised how much you can do in 1 minute. In fact, in some cases, 1 minute is generous. We've had people make 30-minute videos, 30-second videos, excuse me. And those are just as effective. So 1 minute is plenty of time to tell your story. If you can't do it in 1 minute, then you're probably doing something wrong. And of course, there's plenty of opportunity to go a little bit longer. But today we're going to focus on a 1-minute video format. As I said, you can apply the techniques we're going to talk about today to a longer format as well. Now, I'm joined today by one of my truly favorite people in this entire world. John Weiser is an executive at Sony who is probably the best salesperson I've ever met in my entire life. And I've met a bunch of salespeople. I've met people who are professional salespeople. I've met people who are just naturally gifted at selling. A lot of entrepreneurs are really gifted at selling, but John's the best. And I've learned a lot of things along the way from him. He happens to be a personal friend as well. So it's a great joy to be joined by him. John, in his role at Sony, has done literally over $15 billion in deals in his role originally as president of distribution for Sony. But now he's bringing that energy and passion to a new role where he's creating content himself in television. So he'll tell you more about that as we talk today. But one of the things that's so great about John, besides just being an amazing guy, is that he's really an expert at telling a story. And he channels that as a pitch coach in a lot of different formats. He's done that, everything from working with individual scientists at places like the XPrize, which you'll hear about in a little bit. He's also been a coach for the companies that are pitching on Shark Tank. And he's done it with individuals. He'll just sit down and coach people as well. So he's got a lot of different experiences that he can share, and he's just great at telling stories. So it's my great pleasure to introduce my friend, John Weiser. John, I'm going to have you unmute yourself because I muted you. So I'll let you unmute. Hello, John.
Hello, Paul, and thank you for the generous introduction.
Anytime and every time, I'll give you a generous introduction. So, John, I gave everyone a little bit of a story about you, but maybe you could just tell us quickly a little bit about what you do in your current role at Sony, and we'll start there.
Sure. So hello, everybody, and welcome. As Paul asked me to join this process for MedTech Innovators, I'm truly excited about it because I believe in the importance of what you all are doing and trying to accomplish, and the actual where I can get under the hood and help a little bit is specifically in pitch coaching and storytelling. So my role at Sony right now, I've been at Sony for a long time, and my roles at Sony have included head of distribution for feature films and for television. And as part of that process and connecting to the customers and training, global training of our salespeople, I've had the opportunity to really learn what makes a buyer motivated or an investor motivated to put money or resources into your product. So I just shifted, instead of being in distribution directly connected to those folks that are the buyers, investors, I've taken a slightly different path now of creating product, because I understand what the end user wants, so that I can not only really understand the product well, but understand how to make a buyer or investor engage with that product. So the roles that I've had at Sony are president of distribution for film, of television, and currently president of first run television, where it parallels what's going on here at MedTech, where we come up with ideas and then pitch them to the marketplace. That's literally what we do. So in addition to that, just a couple of other things. In addition to like the global sales training, I am invited frequently into universities to teach classes coast to coast. And Paul had mentioned things like XPrize and Shark Tank. So I've enjoyed the privilege of working with those brands and having those experiences as well.
Well, you just mentioned XPrize, and I know that's one of the more recent things that you've done, at least in terms of something new, because you've been coaching people at USC and other places for a long time in Shark Tank. So the XPrize, though, tell us a little bit about that quickly, and what that experience was like for you, working with scientists. I know you were supposed to just be a coach, but somehow you wound up as part of the team. So tell us quickly about that.
Sure. Just so for those of you unfamiliar with XPrize, it's an organization funded by charitable donations with the leading scientists in the world that try to solve the world's problems. Nothing small, stuff like fix deforestation, fix coral reefs in the ocean, clean up toxins in the environment. And I got invited, actually, not even as a pitch coach, but as a guest. And I was sitting in the room listening to the head of SpaceX talk about interplanetary colonization and really some high-level presentations. And after these presentations, people in the room all dispersed to the scientists that most inspired them, and everyone gives you leverage the collective IQ of the room and come up with the best ways to then go present. And what I was finding with the scientists that I followed, who was dealing with early detection of environmental toxins, I found that I was sitting in a group with that scientist, with the head of Google Science, with some very high-level scientists and brains. And frankly, I didn't understand half of what they were saying. Their nomenclature was so high level, and they were speaking shorthand scientist to scientist, that I sat back wondering actually what I was doing there. And one of the rules of XPrize is if you're there, you have to participate. There's no voyeuristic participation. You have to roll up your sleeves. And when it got to be my turn in that group to speak, I had said what I had just said to you, that I appreciate what everyone's doing. I'm inspired by it, but I don't fully understand it. So one of the things we do with storytelling that I applied in XPrize was to dumb things down. And I'm an expert at that. To really take what are complex applications or inventions or programming and colloquialize them. How do you tell a story that everybody relates to, taps into the emotion, and gets a response out of people? So we found myself going from guest the first day of XPrize, with my jaw on the floor going, wow, these people are smart, to, 72 hours later, I was on stage with the team getting funded for an XPrize because we had coached that group into a way that they could talk to everybody, not just each other.
It's a great story. I know we could spend the entire webinar talking about that, but I'm going to bring us back to creating videos and telling stories. So you said something a minute ago about, connecting with people emotionally. So just briefly walk us through, how do you tell a great story in video? What are some of the key things? If you're watching a video, what's going to press your buttons and get your attention?
Well, I think it's some of the elements that I'm sure we're going to talk about during this session, which is you have to be very basic, a clear communicator. What is when everybody is deeply involved in the projects you're working on and really understand them down to the last detail. But to communicate effectively, tell me the headline, not the story. I'm going to dig in for more info if I'm really interested, but to get me interested, what is the clear 3 things that you want me to walk away remembering? Generally speaking, in storytelling, people don't remember numbers and statistics and margins. They remember, how did that pitch, how did that story make me feel? Was there a connection to it? So how do you connect with your audience emotionally? It's tell a story that's relevant for them, either for them personally or for something they care about. And we'll break down during this the structure or the ingredients to the recipe of what a 60-second video should contain to hit the major points in telling that story effectively.
Great. So we will get into some of those videos and we'll actually watch them together, and then we can break those down in a little bit. Before we get there, I want to remind people who are watching this live that we will be asking for questions. So there's a couple ways. If you're participating in this live, there's really 2 ways to submit questions. One, if you're part of our webinar, which means you're one of the companies in our program, or one of the members of our ecosystem who are part of the webinar itself on Zoom, you can use the little Q&A button at the bottom of the screen. So you just kind of move your mouse over the screen. There's a thing that says Q&A, and you can put a question into the Q&A. We will not be answering those live as we're going through this first portion for the next 45 minutes. Instead, what we're going to be doing is doing a question segment at the end. And we'll tackle some of those questions. I should say we'll tackle some of those questions towards the back half of this, about the last 15 minutes of the first hour. And then we'll also have a private session just for our companies, so they can actually ask questions in more detail. But for anyone who's participating on the public stream, which is on our YouTube channel, you can enter questions right there on the YouTube channel in the little chat box. I'll be checking for those. And again, as I said, the last 15 minutes or so of this first hour, we'll get to those questions. So you can enter your questions there, Zoom participants in the Q&A box, and we will get to your questions, I promise.
Paul, may I just, as we get started, I'd just like to double down on something you said, which is, I think, super important, which is it has to do with a mindset reset for everybody, which is, how can I possibly tell my story in 60 seconds? Because unless you're used to this process, it's a little bit daunting to go, I have so much more valuable information, they're going to miss what I have to say. To give you a parallel to this, keep in mind that for years, you've watched millions of 30-second stories in your life that have gotten you to take action. And they're called TV commercials. And they can explain the brand, explain the product, explain the benefit, and get you to go out and buy something. So to have 60 seconds is an actual luxury. It gives you the right amount of time to be concise, powerful, and compelling. So let's just start with, you have the luxury of 60 seconds to tell your story.
Yeah, I think it's a great way of putting it, because you're right. We're all conditioned to listen to these 30-second ads. We've grown up with them, and they continue to permeate our world. And I guess content in general is getting shorter, right? Like we're seeing people go from the the hour-long format or the 2-hour format to the hour format to the 30-minute format to 8-minute videos, 30-second, whatever, that's just something that's really changed. So, I agree with you. I think 1 minute's a luxury. And you don't have to tell your whole story, right? That's one of the keys to this. The mistake that we see people try and do is to jam it all into 1 minute. They say, oh, I got to tell all these things, and they have a whole list of things, but you put it perfectly. It's dumbing it down. It's editing it over and over again, editing, the story so that it's just the essential points, the emotion running throughout it, the connection. You've used this term before, that you said the hero. I've heard you say that to me before. The hero in the video. What does that mean, the hero in the video?
It's what's the hero statement. If you could get, when we do some of the global sales training, and we've got to be very precise because different cultures have different ways of telling stories. So we teach this all over the world. But one of the key elements is in every culture is what's the hero statement? If I can remember one important thing about what you're trying to share with me, well, that's really valuable. So a lot of people love telling the story, but they don't get to the headline. What's the big statement that makes me lean in and care about all your information? So we can all go on, but Abe Lincoln has a great quote, which is, I would have written you a shorter letter had I had the time. Meaning you've really got to work hard to get a simple message out. It's easy to go on forever, but it's impactful. You don't want to be a shotgun. You want to hit it right on the head so someone gets the message and they love it.
Okay, so we're going to watch a couple videos in a minute. Before we do, you mentioned this a couple minutes ago, which is, kind of what are some of the key elements to consider in a video? And I think we can kind of talk about those up front here, and then we can look for them in the videos when we watch them. So I think that would be a good place to start. One of the things I always tell people is, if possible, I'd like to see, the founder or the team or the leaders of the company in the video in some way. So, I'd like to see them in the video. It's not a requirement, and some phenomenal videos don't have anyone from the team in the video. But if possible, I always like to see, the founder somewhere in there and connect with the founder, because ultimately, you mentioned this before, we're just trying to hook people and get people to dig deeper later, maybe to set up a meeting as an investor, whatever it might be. So, I want to have a little bit, if I can, I just like to have a little bit about the company culture, something that makes me feel like, oh, I like those guys. I like those women. I want to connect them. So that's one thing I like to see specifically for MedTech Innovator, maybe not for all product video. Another thing is kind of like laying out the problem and the opportunity. What is it that we're dealing with here, and why should we care? So I think that's an important thing. And then the market is always important. How big is that market? But we can talk about later about how that fits into the story, whether that should be numbers and all that. But you like to see the problem, right? You like to be explained the problem. And then I think the other thing as well too is the question of, obviously, what's your solution? So you've laid out, what is this problem and why should I care? What's your solution? And obviously, there's orders in which we can do these things, but what's the solution to the problem? What makes it unique and different, I think, is important too. Again, you only have so much time in 1 minute, but some little thing that explains why this is different and what's out there, whether it's a competitor or standard of care. You probably don't want to dig into a competitor in your video, but more just to talk about other solutions generically. And then also kind of a call to action needs to be in there somewhere. Come to our website, reach out to us because, join our team, whatever it is, your message, some kind of call to action. I think those are some of the big compelling things. And one last thing I'll mention is having a patient or whomever is this key stakeholder. It could be a surgeon, it could be a nurse, it could be the caregiver for the patient, whoever that might be. I like to see them in the video in some way. And that I think, again, is important so that we know who this is for. Because ultimately, some of these solutions are for patients, some of these solutions are more for a caregiver or somebody else. So I like to know who's the audience. So I think all those things are important to try and work into the video. Any things that I missed or anything that comes to mind and before we watch videos?
I think you landed it perfectly.
Thank you, John. Okay, so one last thing I'm going to put out there before I start queuing up some videos, and that is, does a story need to be linear? Does the story need to have a beginning, middle, and end in these videos, in your opinion, or can it be nonlinear?
It can be nonlinear is the short answer. The story under that is that so many great stories people tell are nonlinear stories. They don't have to unfold that way. One of the favorite pitches that I've seen on Shark Tank, for example, is there was a product called the tree teepee. And what it is a little plastic cone that goes over the bottom of a tree or a plant out on the farms that saves 90% of the water and triples the life that you can harvest food out of. So it saves the farmers money, it saves a ton of water for the environment, and it increases a better yield. And when that person, I think his name was Johnny, came on, he talked about what the solution is and all the benefits for it. And then he got into, I worked as a kid for my dad who was a farmer. And he was wasting all this money, and we would build these things manually and tape them around bottom of the trees. And we finally, right before he passed away, he invented the tree teepee. And I had promised him as he was passing away that I would realize his dream. So all in one presentation, you had someone that started at the end of a story and then told the beginning and then the middle. So it was all jumbled up, but it demonstrated the power of the product. It demonstrated a heartfelt story, and you were rooting for him at that point, and he was funded. So it's really a tremendously flexible vehicle storytelling. And if any of you have seen the movie Memento, you can tell stories in any direction. It's just how do you get your point across most effectively.
Right. For those of you who haven't seen Memento, it's a great film, and it tells the story backwards. The entire movie runs backwards. It basically runs in sequences of backwards storytelling. But anyways, it's unique. So watch Memento. All right. So let's do this. I'm going to queue up a couple videos from last year's program. While this ambulance is going by here near UCLA, hopefully it'll go by. Okay. I'm going to play a couple of videos and then we can talk about them. So the first one I'm going to show is a video from our winner of our best video competition last year. It's a company called VC Technology. And if you look here on my screen, I'm actually going to make sure I shared my screen with a little box checked. Hold on. So what you're going to see in this video, as I mentioned, is the winning video from last year's video competition. So one of the vehicles for one of the things that we do with our 50 videos that the companies in our main cohort produce, plus this year we're going to have another 12 videos from the pediatric cohort and another 20 videos from our Asia Pacific cohort. So we're going to have 82 videos to look at, to talk about next year. That's going to be a long webinar. But for this year, we're going to talk about the ones that were from last year's program. So this was the winning video. We do a contest and the winner wins $10,000. So as one of the things that we do with these videos. So first, let's start off with the VC Technologies.
With good vision, our world looks like this, but 80 million people live with glaucoma. With glaucoma, our world looks more like this.
My name is Rei-Jing Zhang, and I'm co-founder and CEO of VC Technologies. At VC, we're pioneering a next-generation implant called VisiPlate to help patients with glaucoma preserve their vision.
Glaucoma is a disease that affects the optic nerve and causes progressive damage, over a period of months to years.
In eyes with glaucoma, there is an excess buildup of fluid. This is what leads to high pressure and vision loss. Patients today need multiple eye drops per day or implants that are bulky, uncomfortable, or ineffective. VisiPlate lowers eye pressure to help patients retain their vision. VisiPlate is 20 times thinner than a human hair. This allows it to be more effective and more comfortable for patients. VisiPlate works by draining pent-up fluid through a network of microchannels to a secondary pocket in the eye. This lowers eye pressure and protects the optic nerve.
Here at Avisi, our team is committed to helping patients see and see comfortably. Help us create VisiPlate. Help us protect your vision.
All right, so John, what did you think of that video? Any particular comments, especially in the context that we talked before about, what goes into a good video?
I think this is an excellent example of how to do good storytelling. The message is clear. Part of it is driven by a voiceover, which is just one of the techniques available to people. But with the animated visuals, with the actual solution demonstrated, and she ended with, which I think is very effective, our mission here is, our team's mission. And that's the hero statement. That's the headline to the entire thing, is to fix people's eyesight. So I think it was clear. It brings you in because of the demonstration in the beginning with, this is what it looks like with a healthy eye, and this is what a glaucoma eye looks like. So you're immediately drawn in. I think they use several techniques that are highly effective.
I also really liked how, she was in the video. The CEO at the company was there, so at least I got a little bit of a connection with her. And I agree with everything you said. I think they did a great job, and obviously others thought so too, because they won the best video competition, which is actually determined by the audience. We don't vote for that person. We let the winner. We let the community. In fact, in this case, it was an internet-wide competition. So they had votes from all over the place, and then it was narrowed down to a group of 10 companies in the finals, and then a smaller batch that actually got played for an audience live, and the audience picked the winner. So, anyways, that was the first one. So I'm gonna share a second one. So stand by, and John, while I'm playing the video, maybe if you don't mind muting yourself just while I'm playing the video, so because it sounds like there's a little bit of an echo. Okay, stand by. I'm going to queue up our second video. And the other important thing I want to mention as well about these videos, if you go to MedTech Innovator's website, so it's just medtechinnovator.org, at the top, you'll see the little navigation bar. In the navigation bar, it says US program. If you scroll down there in the little nav and it says portfolio company videos, that's the page I'm on right now. It'll start off with the videos of the companies that were in our 2019 program first. And you see tabs here for all the other years where we've run this program going back to 2013. So you can click on each of those tabs and see all the companies. And as you see here on the screen as I'm scrolling, we have all the videos that were submitted that year by the companies, or produced that year by the companies. So let's play a second one.
Almost everyone watching this will have an operation at some point in their lives. Over 310 million surgeries are performed each year, and all of those leave a wound that needs closing. This is usually done with sutures or staples, but both have drawbacks. Sutures are slow, increasing the length of anesthesia and cost of procedure. Staples are faster, but have increased infections, worse cosmetic results, and more pain for the patient. This is why a surgeon from London and a rocket scientist from NASA came together to create the Quick Stitch, the perfect wound closure device. The Quick Stitch is a fast and easy to use device that inserts the perfect stitch every time. It achieves superior wound healing by providing the optimum tension and perfect wound eversion in every stitch. The result is a better cosmetic scar, reduced infection rates, and less pain for the patient. When you have your operation, you'll want it closed by the Quick Stitch.
So different video. What are some of your observations from that, John?
Love this video. It uses a technique of dual communication, which is You had this great voiceover narrative explaining a very easy to understand story that, be it a medical professional or a patient, could completely understand and buy into. But by having statistics and identifying the people on the screen, you're not overloading the person receiving the presentation with too much information through the dialogue. So what happens, the way the mind works, I think we've all, whether you're on let's call it a newscast or a financial television show where the person's talking, but they have important news flashes at the bottom. It's very tough for someone to focus. They don't know which one to go to, and they have a hard time absorbing either. What happens in this video is when he's talking, you quickly read the facts that's supporting it, and then you just rely on the voice and the pictures, because what he's done is established credibility through facts that allow you to then just default right up to what he's saying and what you're watching. So he did an absolutely great job of making, giving the headline, drawing people in, and communicating a lot of information without overwhelming the audience.
Excellent. So one of the things I wonder about sometimes is, if you're making a video and you're not super confident on screen. I know I've done this many times, where I try to make my own video and I'm like, I messed up, or I couldn't say that. How do you prepare for, for doing something like this? For even if you're going to be only on screen for 10 seconds, whatever. How do you do that well? How do you prepare for that?
That's a great question. This only applies for people that are listening that have a phone. This is just for this subset of the audience that carries a phone around.
It's only a small portion, so.
Small portion. Yeah. Do the most uncomfortable thing you can do as a first-time presenter, which is tape yourself with your phone, giving the presentation, and be honest in your self-evaluation. Get your pitch down and pitch it into a mirror and look at yourself. You should be able to give a pitch regardless of how complicated you think your product is or the story you want to tell, to somebody outside the industry where they lean in. I don't know much about sutures, but I can tell you, I watched that video and I know all I need to know about that product to know it's a winner. So practice will give you great results, and you have to tape yourself because you'll be so surprised about your posture and what you're doing with your hands. You'll learn a whole lot if you objectively view yourself. Your phone is your best friend. Your phone and Zoom, apparently, too.
And Zoom. Now we spend all day long looking at ourselves, and I realize, I'm not standing up straight. So that's great. That's great advice. I know, in addition to making the videos, that the companies that have excelled in MedTech Innovator in our competition format, so when they're on a stage, have practiced their pitches hundreds of times. And I'm not exaggerating, hundreds of times. So that's great advice. One last thing also I'll ask about is credibility. How does someone establish credibility in a video? If you're not a surgeon, that last video, the founder is a surgeon. What if you're not a surgeon? How would you establish credibility in a video for the company and for the product?
Oh, it's always the end user. So that one of the most powerful forms of advertising, communication, storytelling is a testimonial. So it's someone who's received these going, I was so scared I'd have a scar on my face from the bicycle accident, but look, I used Quick Stitch, I used the device that's being pitched, and I couldn't be happier. Let someone know it was effective and they're thrilled because they used the product. So either your team and or your credentials or a third party validating that you are an expert in the field and your solution works.
Excellent. All right, let's watch another video. So this next video is from a company called Ischemia Care. So let's cue that up.
Every 40 seconds in the US, someone's life is dramatically impacted by a stroke. Imagine the frustration for clinicians and patients when after days in the hospital, the cause of stroke cannot be determined. This is the reality for 250,000 patients each year. What if a blood test could determine cause of stroke? ISCDX is that test. Our passion is to empower clinicians with better tools to improve these patients' lives. We identified unique gene expression patterns to confirm whether a stroke occurred or not, and to reveal the underlying causes, including atrial fibrillation. Our tests enable a personalized approach to diagnosing and treating the 2 million patients each year with stroke symptoms.
Know the cause.
Know the cause.
Know the cause.
Change the outcome!
All right. What'd you think of that?
I thought it was okay. What I pull away from that is a bunch of really important fragmented statements. And although the know the cause is what I come away with, I would have rather, excuse me. I find it easier to digest if it's, 2 million people a year are affected by strokes, and we can mitigate most of those if we know the cause. But what he did was he broke that statement up into 4 different areas on the video. And it's up to me taking it away to piece those together to go, wow, I guess that makes sense. Don't make me work that hard. You need to fortify me. Don't make the receiver of the presentation expect that I'm going to do the homework.
It's really interesting you say that, because this is a video that last year I remember watching, and of almost all the videos, it was the one that I left kind of like with a feeling of like a smile on my face at the end, because I really like the founder and I like the team. I like Jeff June, who's the CEO, and I like the team. And you got to see them in the video, and I really, and they're cheering at the end, and and a whole bunch of other people saying know the cause too, kind of like joining into the hero statement. But that was the thing that left me, at the end of that video. I was left with that. I was left with like, I really like them, and a smile. But that's what I remembered, versus what exactly did the product do again, and what problem are they solving? And so I think there's, in some ways, it worked to their advantage, because this is a great company and they've done very well, and I'm really proud of what they've accomplished with ischemia care. But I think, other than leaving with like this really great, like, oh, I really like those guys, you almost have to go back to your point and rewind the video and watch it again to go, okay, wait, what was it that they did it again, and how did they do it? Because there was so much of that, like change the outcome, know the cause, that I didn't really understand I didn't leave really thinking about how they did it at ischemia care. So I think that would be an improvement that they could do in the future. But like, as I said, it's still an effective video. It's more effective at making me like Jeff and their team, and knowing that they got a bunch of people who, also seem to think that knowing the cause is important, which I guess, as I said, is better. All right. Let's go on and watch a couple more here, and then we can break down some of the things that I think people need to know about in making their videos. So here is a video from a company called OncoRes Medical, based in Australia.
Every 16 seconds, a woman is diagnosed with breast cancer. In developed countries, 65% of women have a lumpectomy rather than a mastectomy. But 1 in 5 lumpectomies require repeat surgery, as cancer is left behind. Avoidable repeat surgeries create a $1 billion burden on healthcare systems and create significant time, cost and distress for patients and families.
Having worked as a cancer surgeon and researcher for over 30 years, every day I witness the emotional and physical devastation that cancer causes. Too often surgeons have to tell a woman that we haven't got all the cancer the first time and she has to have another operation. This is a global problem, because without an intraoperative tool, we are relying on our sense of touch to ensure that the entire tumour has been removed. I want to be able to confidently tell her that we've got it all.
OncoRes is developing a highly accurate handheld probe that translates the surgeon's sense of touch into a microscale image. Surgeons will use the probe inside the surgical cavity to identify tumour that has been missed. Let's help surgeons get all of the cancer out the first time.
So, thoughts?
Thoughts are, this is an example of linear storytelling where they have the facts build up to a conclusion, but they rely on a couple of things that I think would, if they change them, would enhance their story and the recall of that story for the people watching it. So they start off with, I think, the fact like every 16 seconds there's a diagnosis, 65% of those, and then 1 out of every 5. There was a lot of numbers. People don't really remember numbers. You can't relate to numbers unless there's context to those numbers. So I would have kind of went back to nonlinear storytelling. I would have taken the second section where that doctor was with the patient, and the headline, the hero statement to that pitch was, we're with patients all the time and we have to tell them we didn't get all their cancer. And if we have an intervention tool, we can solve that. I get it. Now I'm interested in your numbers. Now tell me how big the market is. But they started with all of this information that until I figure out as someone receiving it, why I care about your numbers. Don't hand me a bunch of numbers. I don't know what to do with them. So I would have changed the story, hooked the emotion early, given the headline, and then I want to read that article because it's great information what they're doing in this presentation. They could have been better storytellers at it.
Yeah, I think, production quality in this one was tremendous. In fact, I think all the videos we've watched so far have had great production quality. I don't think any of them were done by professional crews per se. I think they were just talented people who, are good at shooting video. To your point before, you can shoot great video on an iPhone these days. And I agree that the hook, the thing that got me was that moment where the surgeon sits there with the woman, and she's breaking the fourth wall. She's talking to us, and then she looks down and and says to the patient, we got it all. I want to be able to tell her that. That was awesome to me. And you're right. I think this video, which I love, would be so much better if you flipped it around and started with that and drew me in, and then towards the end hit me with the numbers to be like, wow, this is amazing, and this product looks incredible. Oh, and a huge opportunity too. Where do I call? Like I got to reach these guys. Is this still the symbol for call? I don't know. Anyways, the point is, I really love the video, but I think you're right. I think flipping it around, it doesn't have to be linear. That's the point. So good point for everybody to be aware of. The other thing too, I want to point out in these videos that I haven't been pointing out so far is that the people in these videos are not actors. The people in these videos are team members, that are part of the team. Our friends, in some cases, are the real surgeons. I mean, they don't have someone acting as the surgeon that is actually a surgeon. But the point is, you can have anyone participate in these things. You don't have to go out and hire a crew or cast people to be in your video. That you can produce these things and do a really good job. Something that we haven't really gotten into, John, is the aspect of actually creating the video. So before we get to questions, I want to spend a little time on that. Do you recommend someone sits down and just starts shooting and then goes back later in the edit room to try and figure it out? Or should they plan this whole thing out and storyboard it? What's your recommendation?
Paul, I like to speak in analogies, so I hope this applies for you, but I love cooking. And before I start cooking, I have a recipe and I know when to fold in what measurements of what ingredients. So the media term for creating a video like that is the term you used, which is storyboarding. And what that means is once you determine what are the elements of what you want to communicate, what's, the market, what's the problem, what's the market, you're the unique solve, why are you the experts, what action do you want them to take, or what's your team going to do? Once you mount those elements and figure out what order you want to tell your story in, then define that. Okay, so in the first segment, we know we have 10 seconds. In the second segment, the real story part, we want it to be 20 seconds. Then we want to go 10, 5, 5, whatever the math is you want to tell your story in. And then once you have that, then you have a plan to put a camera on it. But if you just start talking, it would be unusual to convert that into a great story without a plan to tell a great story.
Excellent. So storyboard for sure. And I recommend the same thing. We have our companies, we offer to all of you who are participating in this webinar, send us the script in advance. You send it to everybody else too. Don't just send it to us. Send it to your friends, your spouses, coworkers. Have them read it, and kind of read it out loud to yourself. Read it out loud, read it to yourself, whatever. But spend some time and kind of go over it over and over again, and get it down to like, am I telling a story that someone's going to care about before you start shooting? Because otherwise, you're wasting your time and sometimes money as well. But even, your time is valuable. So make sure you storyboard it out, send it to us. We're happy to comment on it. We'll send it back and say, cut that out. That's not necessary. So please do that. I highly recommend that as well. All right. One of the things that I've gotten is a bunch of questions that people have been submitting, both in our YouTube channel and here in the webinar. So I'm just going to ask a couple of those questions right now, and then we'll wrap up and cover a couple more points, John. So first of all, one of the things that people were asking was about, how to make an animated video. How can you do that on a skeleton budget? And just kind of saying, what are some resources for that? So I'm just going to generally make the statement that after this video, we will post some comments to our YouTube channel in the comment section to this video that you can go to later. So there'll be some links to some resources where you can find all sorts of animators and people who can do this. The great news is that we're in a very flat world these days. COVID's made it even flatter. And there are animators everywhere who are happy to make videos for you for a very reasonable budget. One of the most important things we can do is give you some recommendations, and we will do that. Also, I want to note that in addition to today's video and webinar, which is more about telling the story, we're going to have some separate webinars that I'm going to do just with the people who made these videos and let them tell us about how they did it. So just real short, it's not going to be, each one's not going to be an hour. It might be 5 minutes of me talking to that person, and they'll say, I had my wife hold the camera, or my iPhone, or I did it myself on a tripod, or see that shot over there, that was, I taped my thing onto the window, and that's how, whatever it is, they'll tell us those kinds of stories. So we'll get into those techniques later, not in this video. Another question someone asked is, should the founder look into the camera or to the side? Some of the videos do it both ways, John. What are your thoughts on that?
I think both can be winning ways. You have to watch yourself on camera and make a decision. I think there's no wrong answer to that. It can be done both ways effectively.
Okay. Some people do both. Some people have like two cameras going. They have like one on the side, or it seems like they do. It seems like they have one camera on the side and one in the front, and and they're cutting between the two. Do you think those are usually done with actually two cameras? Do you think people shoot this thing 5 different times, and one from the front, one from the side?
I think probably both. I think what's important in all of this, something that comes through all the time is this person genuine? So you have to find what you're comfortable doing, because when you're comfortable, you're confident. When you're confident, that comes right through a camera. And it's not to be overly confident, but if you're comfortable in your own skin when you're doing this, if that means looking directly into a camera or looking off to the side, because that's a greater comfort level, that's the most important aspect in making your decision. Where will you be your best? Not what the audience wants to see. How can you present yourself in the best and most authentic way?
Yeah, that's great. I mean, when we make our videos at MedTech Innovator, which we'll do later on, I always have our interviewees look off to the side a little bit, like they're not looking actually at the camera. And I tell everybody to do it. I send a picture to everybody and say, can you please look this way? Because I want them to see exactly what we want, so that it looks, it's going to be what we want at the end. And I think one of the things that is really important today more than ever is in this COVID world, and someday in the post-COVID world, that when you make your videos, you're going to have people who are contributing content that are not in the same room with you, that you're not directing. And maybe you're lucky, and we actually when we do have people remotely make video, I'll have somebody else FaceTiming in the room, so I can actually watch it remotely and kind of direct. So I think that's a tip that people can use. But whatever ultimately the direction is, make sure the direction is clear, because people are only going to do this once for you. And if you're going to ask them to record something, then make the direction very clear. Show them, record it yourself and say, this is exactly what I want. Just do the same thing, whatever it is that you want to tell people. I think one of the most effective things, you've pointed this out before, is when you see that surgeon or someone with credibility on the screen, you buy what they're saying. We want to see more of that. In the COVID world, everyone's at home. Most people are available. They can do this. They can get on, they can record a video and send it to you. I think that's a luxury we actually have now, versus having to go send a crew or send your team out to some hospital somewhere to ask them to do that. Okay, a couple more questions that some people have asked. One of the questions that someone just asked live was, how important is that the company culture shines through without risking kind of diluting the core message? So, should the video be tailored to, like, the question that they're asking, should this video be tailored to a narrow audience, just like investors, or should it be the customer, or should it be maybe to, recruiting talent to join your team? I'm going to start with the answer, John, to this, and then I'm curious for some of your thoughts too, which is these videos should be timeless and they should serve kind of all purposes. So ideally, they're a video that will be attractive to an investor. Ideally, it's a video that will be attractive to potential partners who might want to work with you someday, because it could be a year from now they're watching this video. It could be to a patient who's considering entering a clinical study you're doing. So I think it needs to kind of communicate to all those audiences, which I know is hard. But as I think from the videos we're watching so far, you'll see they pretty much do that. Any other thoughts you want to share on that, John?
I think you said it perfectly. This is just a timeless video that tells your story, which will serve everybody watching it. A good way to test the story is if you can tell your story or record your practice videos and show it to family members, friends, anyone in or out of the business, and then shut it off and say, tell me if you understand the video. Everyone should be able to say, not only do I understand it, that's a great idea. Because until you land it across the board, whether it's investors or constituents or, the question started off with, should I be talking about my company culture? It should talk about the best version of your idea, whether that includes culture or not. We saw one of the CEOs make one sentence, which is all we had to hear to get the message about company culture. She said, my team is capable of doing it. She referenced her team's capability. So right off the bat, you knew that company culture is, here's a CEO that respects her team and that they're capable to do things. That's all I needed to know, that they have a healthy company culture. You could have 50 people on the end of the video, like one of know the outcome. Know the count, where they had a bunch of people. Well, that's a friendly company culture. That's a 3-second sentence, the CEO said, or a 3-second piece at the end. And I understand those two companies' culture enough that I have confidence and likability about them.
Great point. I ultimately believe these videos have to be universal. Most of the people who are going to be watching these videos are going to be either on your website. A lot of our, in fact, almost all of our companies put these videos right on their homepage at the end of this, because it's the best job generally they've ever done at telling their story. And every one of our companies makes these videos. And if you go look at all 50 videos from last year's cohort, they're all good. There's not one video in there where you go, what are they thinking? They all come out good. They all come out acceptable in terms of an overall mission that I would say have for these videos. But obviously they vary in quality and they vary in likability and all those other things we're talking about. One other thing that I think someone raised in the Q&A that's important for this portion of the live broadcast is the question of whether or not you can get into trouble by making claims with someone like the FDA. And I think that's a really important point that, these videos, we've said a couple of times now, need to be timeless. And I've had people email me a year later and say, do you mind if we take down our video because we said we were going to be in the clinic at the end of the year and we actually got delayed and I need to take that out. Or they've said, oh, can you please take this section down in the video? We realize that maybe, we're making an FDA claim here that we shouldn't be doing. Can you please take that video down? And I don't want to take the video down because I want people to know about the company. So, generally our answer is, of course, we'll take it down, but please edit the video, take that little segment out, and let's preserve the story. So I would just say, don't, do it right the first time. Don't make FDA claims. You can be very careful about how you word these things. And if you're not sure about that, as I said, send us the script. Send the script to your regulatory person and say, can I say this in the video? You just be careful. The video format is like any other format, your website, document you're going to send people. You should be very cautious on how you word things and understand that we are in a regulated industry. Even if you're making a consumer product, there are limitations on what you can say. So be very careful with that. I want to make sure we got that in the public broadcast. As I mentioned before, what happens now is we kind of wrap up the video, the live portion that we stream on YouTube and that we archive on YouTube, and we save the last 30 minutes for our startups so they can ask questions directly to us that aren't recorded and that are not going to be broadcast. But before we do that, John, a couple of last things that I want to ask you that we didn't talk about in detail yet. One of them is animation. So I encourage people again to go to medtechinnovator.org/live to see our webinar series, and medtechinnovator.org, and then go to the US program link at the top and go down to where it says portfolio company videos and watch these videos. There's a lot more of them. We've had them now from every one of our companies for the last 8 years, or 7 years prior to this. This is our 8th year. And watch the videos. There's a ton to learn. As I said, the ones that have won or that made it to kind of the finalist category for the video competition are near the top, generally on the page. And so that's a great place to start. You will see some animated videos. So John, what's your take on a company that just makes the entire thing animated? No founders, no patients in the video. The whole video is animated. We've had a bunch of those. What's your take on those?
I think they can be highly effective. It's just a form of storytelling you're choosing. The video that I think does, there are many, the first video we saw had an animated section to it. I would suggest looking up, I think there's an animated video on the laparoscope technology where people, every 12 minutes or 12 seconds, they've got to take the laparoscope out and readjust it during surgery, and it causes all these problems for the surgeon. And it's super simple, low-level animation, but super high impact because it's just great storytelling. So you don't need to find an animator that's out of work from a big company. There's all different types of animation available. And that's, I think, Paul, it's a great suggestion to go into your archived videos, find out what type of animation appeals to you as you want to tell your story. And then you can use Google and either track down some of those people, or MedTech may have a lead on who did that animation so that you could approach them and see if it's cost effective for you in a way that fits both your time and your budget.
Yeah, no, that's a great point, by the way, that I've never considered until just this second, which is that we could include some notes on the pages for the individual videos, maybe in the comments on YouTube, for example, with who produced the video. If they used an outside company, or if there was an animation, who the animation company was. Frankly, a lot of people do this themselves. And they find that in their company or in their little network, they have talent who's able to make animations. There's all these great tools that are available for free or for nothing, relatively nothing, that let you build those animated videos. So the one you were talking about was ClearCam. And I don't know if it was the case for them. We'll delve into that with ClearCam in another discussion, but there are tools out there that you can go on and you can literally drag and drop those like little kind of animated figures. And, you know, it's all kind of just pre-built and ready for you, but you animate it and you say, I want to start here, and drag it over there over 2 seconds, and it just does it. And it's unbelievable how accessible this technology is now. No one's animating, or most people aren't animating these frame by frame anymore. So that's a resource. Something else that we should cover too before we wrap up here is stock footage. A lot of the videos that we watch today, and a lot of the videos in our program, use stock footage. And we see that all the time, where someone comes in with, you know, this great looking shot, and, you know, of the doctors talking with, you know, some patients, and, you know, that was stock footage that they got for $1 online. I mean, and I don't know, I mean, was it obvious to you, John, when you were watching those videos, what was stock footage versus what they shot themselves?
Absolutely not obvious. And it's just a question, it's a shopping trip. You go to, there's a million places you can buy very affordable stock footage to elevate the quality of your production and just make sure it matches the rest of the production value of your video. But it's a great tool to use that happens in a lot of forms of video storytelling. Good.
And also another thing that I know is out there as a resource, especially for people who maybe, you know, English isn't their native language, and we're asking everybody to do these in English. And we always ask people to try and, you know, have them be the person narrating it. But if there are occasions where someone's like, you know what, I'm just not comfortable with that. And you could use a narrator. It could be somebody else on your team, or you can go out and you can use their websites now. And we'll put the comments in later into the video link, but we'll actually use these services, you know, many of our companies that will narrate the whole thing for you for like $10, you know, and they're great. And you can choose, you can go through the thing and say, I want someone who's got like a powerful voice, or someone who's got an operatic voice, or I want someone who's funny, and you can just tell the lilt in their voice or whatever. And you can go through and you can get bids from different people, and literally it's like 10 or 15 bucks, and they just record the video for you. So there's great tools out there for voiceover. And I think it's fine having another voice if you're not comfortable with it. I encourage you to use your own voice, but, you know, because again, to John's point earlier, you want to connect with somebody. And if you can, there's no better way, I think, with that person on screen a little bit and with their voice. You definitely don't want to be a talking head though, right? For the whole video, John?
Correct. You make it, you know, it's clearly a video is a visual learning medium, and you've got to make it interesting. So if you have someone just spending a minute talking on camera, you haven't stimulated my other senses to engage with you.
Yeah.
So I think along with that, I think be aware as you tape yourselves on your phone, video yourselves on the phones, is to be very cognizant of your body language. Your body language, whether you have hand movements or head movements, has to be consistent with your message. And it's extremely important that there's a consistency and parallel between the two, because we are hardwired as a species to read body language over what someone says. Body language is more powerful. So make sure that when you're communicating your message, if it's authoritative, if it's hopeful, your facial expressions and your body movements are consistent with your words. And it doesn't need to, you don't need to get thinking this is a big area of study. Just use your common sense when you watch the video to make sure the pacing, the tone, the pitch of your voice, and your body movements are consistent with the script that you're going to storyboard for your storytelling.
Great points. Great conclusion, I think, for the live portion of this broadcast. John, thank you for those tips. Again, for anyone who's watching this, I mentioned that we will be putting this video, it's already actually going to be on YouTube, on our YouTube live channel. You can get there by going to medtechinnovator.org/live. That's where you'll find a link to our YouTube channel. All the videos are archived both on our website and on YouTube. On YouTube, in the comments, that's where we'll place some references to the things we're talking about. So that'll be an opportunity to learn more about maybe what went into making these videos. John, tremendous tips. I really appreciate all of the things that you've taken the time to share. I'd also point out that we archived your and my discussions from the past years. We've done this a couple times before, and I'd encourage people to go back and watch the old videos because they're different every time. The story evolves, right? You're always evolving in what you do and how you do what you're doing. You've told me recently you're creating new content and new formats. So it's great. So John, any last words?
I would just say one of the reasons, not only that we've been friends for so long, but that I'm happy and honored to be part of this process, is that the work that's going on, that everyone watching is doing, and that MedTech Innovators is helping enable, is so important to the future health and well-being of patients, of the medical industry, of the quality of life, that to contribute in any way is really an honor to participate. And I just want to encourage you all to stay on the path that you're on, to keep innovating and helping other people.
Thank you, John. All right, everybody. So again, this is the end of our live broadcast. If you're one of our companies on the Zoom, stay on, because we're going to continue on now and have a live discussion. For everybody else, again, go to medtechinnovator.org/live. There's a button there to subscribe, not only to our YouTube channel, which you should do, because then you'll get notifications of when we have new videos. We'll be doing these every week. Secondly, there's also a place to RSVP, and that'll send you a reminder email in advance. If you subscribe on our YouTube channel, you get literally like a MedTech Innovator is live now email. But if you subscribe using the other form, that will let you actually get a reminder email in advance, not literally 1 minute in advance. It'll be, I think, days in advance or a week in advance. So that's the resources. We appreciate your being part of our audience today. Looking forward to seeing you all in the future. Good luck. And if you have questions about making videos, you're welcome to reach out to me, paul@medtechinnovator.org. I'll answer your questions at any time that I receive them. So please send in your questions. Happy to do that and happy to be a resource. Thanks again for everybody watching this live, and have a great day, a great evening, or whatever time of day